Okay, so the subject is basic hematology and the subject code is BMLS 2002, and in this topic we will discuss about urine microscopic examination. So if you see the syllabus, the fourth unit consists of normal hemostasis, physical properties of coagulation factors, radioactivity, definition, half-life, physical decay, and urine analysis. So why do we are studying urine analysis in hematology is because whatever blood degradation or whatever blood products that will be excreted in the urine, especially such as bilirubin, and also in certain cases when there is some hemolysis in the body, then the urine consistency will change, especially the crystal formation in the urine can be seen. So urine analysis plays a vital role in parallel with blood correlations. So that is why we are studying urine analysis in hematology. Of course, urine is a filtered blood. So blood will filter into urine, right? So urine analysis can be break down into the following topics. So indications for urine analysis include suspected renal disorders, detection of urinary tract infection, some jaundice, diagnosis of jaundice. Jaundice occurred due to especially hemolytic jaundice. So when there is excessive red blood cell degradation, then there is a high concentration of bilirubin, and that in turn causes jaundice. So in this way, we are going to study the urine analysis from the point of view of blood. Okay, so there are many methods of collection of urine, such as random urine, morning urine, clean catch midstream urine, 24 hours urine collection, postprandial urine collection, and suprapubic aspiration urine collection. Then, so if you keep the urine at normal room temperature, then urine will start undergoing degradation. So that is why preserving urine is a very important thing. So if you left the urine for a while, means it causes pH changes, the crystals will be formed, there will be loss of ketone bodies, there will be decrease in glucose, there will be oxidation of bilirubin, oxidation of urobilinogen, bacterial proliferation, disintegration of cellular elements may occur. So that is why preservation of urine is very important. So urine generally preserved at by using or at 4 to 6 degrees centigrade in refrigerator, or by using HCl, toluene, boric acid, thymol, or formalin crystals can be used for preservation of urine. Then what we are looking in urine microscope. So in urine examination, we will go with three parts. One is macroscopic or physical examination of urine. Second one is a chemical examination of urine. And third one is microscopic examination of urine. So for hematological point of view, chemical examination and the microscopic examination of urine is very important. Anyway, I will just go through everything so you will get some idea. So physical examination. So physical examination means this is the things that we will observe with the naked eye, such as volume, color, odor, pH, and specific gravity. So the normal urine volume is around 2 liters per day. If it is less than 400 ml per day, then it is called oliguria. If there is no urine production, then it is called anuria. If the urine production is greater than 2 liters per day, then it is called polyuria. Okay, so the color of urine will be around yellow to straw color. So the variations in the color changes may indicate a significant problems, and it may correlate with diseases such as more blue, more yellowish or dark yellow color urine indicates jaundice. In case of biliverdin conditions, then there will be yellowish green urine. In case of alkaptonuria, the urine will be black. Okay, so usually we are concerning about the deep yellow or dark yellow color urine, which is occurred due to jaundice, that in turn occurred due to abnormal degradation of red blood cells in the body. Of course, bilirubin is a byproduct of HB degradation, as we discussed in our previous classes. And the appearance of urine will be clear. In some conditions, the urine appearance may change into amorphous because of presence of pus cells or bacterial or other microorganisms. Then odor. So the normal smell or odor of urine will be sweetish smell. So in some conditions, the odor may change, such as musky or musty odor can be seen in phenylketonuria. Ketoacidosis, you will see fruity smell, and ammoniacal smell can be seen in E. coli infection. Then specific gravity. So the specific gravity indicates the number of particles suspended in a unit volume of fluids. So the normal specific gravity of urine is around 1.016 to 1.022 specific gravity for 24 hours of urine. Okay. Then there are some methods of detection of this specific gravity. This is not required as of now in this particular subject. Maybe we will discuss this in the future semesters. Okay. So I'm just keeping these parts of this part of this lecture. Okay. So the normal pH of urine will be acidic around 4.6 to 8. And I'm just going to the microscopic examination of urine. Of course, in chemical examination, we will go for detection of bilirubin, because bilirubin is the hemoglobin degradation or RBC lysis. So hemoglobin, bilirubin test is one important chemical test, and other one is microscopic examination of urine. So let me skip and let me go directly to the microscopic examination of urine. So microscopic examination of urine, as the name suggests, here we need to observe the urine under the microscope, and we will detect the following elements in the urine. So we will detect the cells, casts, crystals, organisms, and other substances. Cells means here we can able to detect red blood cells, white blood cells, epithelial cells, and fat cells. And this table is very important for your exam. So try to pay utmost attention in this particular part of lecture, because this is very important for your exams also. So so in the urine sediment, first what you need to do is you will take a test tube, you will add a 1 ml of urine, you will go for centrifuge. Upon centrifuging, you will get a sediment, and that sediment, with the help of that sediment, you will make a smear and you will observe the smear under the microscope. So in the microscope, we can able to detect cells, casts, crystals, microorganisms, and other things. Cells such as red blood cells, white blood cells, epithelial cells, and oval fat body cells can be detected. Casts means these are the non-cellular or acellular anucleated cells are called casts. So here we will see cellular cast and non-cellular cast. Cellular casts include red blood cells, white blood cells, epithelial cells, whereas non-cellular casts are seen in hyaline, granular, waxy, and fatty non-cellular casts can be observed. Whereas crystals, so presence of crystals in urine is a common phenomenon, but now we need to identify the normal crystals from the abnormal crystals. So usually the normal crystals that are suspended in the urine are uric acid crystals, calcium oxalate crystals, amorphous urate crystals, calcium carbonate crystals, phosphate crystals, and urate crystals. Whereas the abnormal crystals that we can able to see in the urine are cystine, cholesterol, bilirubin, leucine, tyrosine, and sulfonamide crystals. So the detection of these crystals gives us a crucial information about the pathological status of the patient, especially the hemolytic status of the patient. Is there any internal hemolysis? Is there any blood breakdown? Is there any RBC lysis? Is there any complication upon getting blood transfusion? All these things can be detected upon detection of these abnormal crystals in the urine. Okay, apart from this, we can also able to identify microorganisms such as bacteria, yeast, protozoans, parasites, or even some fungal elements can able to detect in the urine. And other things that we might see in very rarely include sperms. Okay, so these are the things that we will see in the urine microscopy. So now I will directly move on to the crystals of urine microscopy. Okay, because crystals will give a crucial information about the hemolysis. Okay, so I'm just moving forward to the crystals. Okay, so these are the crystals we are discussing about. So we have uric acid crystal, calcium oxalate crystals, hippuric, calcium phosphate, triple phosphate crystals, calcium carbonate, and ammonium biurate crystals. Whereas the abnormal crystals include bilirubin, cholesterol, cystine, leucine, tyrosine, sulfonamide, acyclovir, and indinavir crystals. Okay, now in the exam, if I'm asking this question, everyone must to draw the normal and abnormal crystal diagrams. You must to draw diagrams of each and every crystal of this particular table. Okay, so these are the abnormal crystals that we can able to detect in the urine. So the basic definition of crystals are reflective structures with a definite geometric shape due to orderly three-dimensional arrangements. So there are many types of crystals: amorphous crystals, aggregates, granular crystals, etc. Okay, so crystals can also be seen in acidic acid crystals and alkaline crystals. So the crystals that can be seen in acidic urine are calcium oxalate crystals, uric acid, amorphous urate, leucine, tyrosine, and cystine crystals. Whereas alkaline pH crystals or basic crystals that we can see in the urine are amorphous phosphate, triple phosphate, calcium carbonate, and ammonium biurate crystals. Okay, so these are the conditions where we can see the various crystals and their diagnostic utility. Okay, so So for example, in case of urinary tract infection, you can able to see magnesium ammoniate phosphate crystals, which are occurred due to alkaline of urine, okay, alkalinity of the urine. So these are the crystals that we will see in the urine microscopy. So this is all about the urine microscopic and its a clinical correlation with the hematology. Okay, so a quick revision of today's lecture. So in today's lecture, we discussed about the urine examination. Okay, so why we are studying urine? Because urine examination is a direct reflection of the blood status in the body. If there is a high hemolysis, then there will be high bilirubin, hence results in a more yellowish urine. And also due to heavy hemolysis, there will be changes in the urine, and the crystals can be seen in the urine. So in this way, that urine examination is very important in hematological diagnosis. So urine things can be seen. There are many types of urine samples: random, morning, clinical, 24 hours panel. Then we discussed about the changes of urine upon keeping the urine in room temperature. Then we discussed about the preservation of urine. Urine can be preserved by refrigeration, HCl, toluene, boric acid, thiolome, and formalin crystals we can use. Then urine examination can be done in 3 phases. One is physical examination, chemical, and microscopic examination. Physical means this is the things that we will see via eyes, with the naked eye, such as volume, color, order, pH, and specific gravity. Then coming to the chemical analysis, in the chemical analysis, we will go for detection of ketone bodies, bilirubin in the urine. Okay. Then last and finally is microscopic examination. So in the microscopic examination, we are going to detect cells, casts, crystals, organisms, and other things. As I said, crystals plays a crucial role, so you need to pay utmost attention in the crystals. So we have 2 types of crystals: abnormal and normal crystals. That include uric acid. The normal crystals include uric acid, calcium oxalate, hippuric acid, calcium phosphate, triple phosphate, calcium carbonate, and ammonium. Whereas abnormal crystals include bilirubin, cholesterol, cystine, leucine, tyrosine, sulfine, and alpha chloride, and indinavir crystals. And the pictures of these crystals are very important for clinical correlation. So thank you very much, students. This is all about the urine examination. All the very best for your exams.